Thank you. My name is Veronica, so don't worry, everybody calls me Veronica. Nobody can say my Italian last name. Okay, so I'm a pediatrician. I did my training in developmental pediatrics in Vancouver, Canada, but I'm originally from Argentina, so that's my Latin accent. So I have connections with, I have worked in Argentina and in Canada in clinical setting and in research settings. So, I'm a privileged physician and I've been, have relationship with people in different countries and have traveled because of my research. So I try to include all those perspectives and learn from my studies. And one inspiring one was a qualitative study that I did with kids with cerebral palsy. So listening what they have to say. It was a lot of planning before starting the study because we thought we couldn't get enough information, and when we started the study we couldn't stop. They were really teaching us how to talk and how to listen. So this is, as a result, I'm trying to change and run studies and present my results in a different way. So hopefully you can see that. This is just one of the studies that was selected and I was invited to share with you today. So what do pediatric pain tools really measure? So the instruments that I'm sure clinicians have asked you to fill out or have specific questions that you see that they're asking about to address pain. So chronic pain, I don't need to embrace why it's so important. I think, I'm a mom, and if my child is in pain, it's even worse for me. I can feel the pain, and it's very distressing. But chronic pain lasting more than 3 months in kids with cerebral palsy is something that we need to be aware as physicians and researchers. And one thing is because it's quite prevalent, so different studies are telling us that as high as 70% of the study are identifying kids that are having chronic pain. There are multiple sources, so it's really hard to manage when you don't have one single thing, if you have different sources to tackle. And impact all level of functioning. So CP, is on a spectrum. The kid has different abilities, but chronic pain is present in all the whole spectrum. So it's not just for kids who cannot walk, so it's something that we need to think in every single kid. Why is important again? Impact quality of life, interfere daily activities, so what they do every single day, impact family functioning, so if we are in distress, they are in distress, so happy mom, happy families, happy kids, and predispose to chronic pain in adulthood. So my colleague will comment on chronic pain in adulthood. So, this is something that is linked, and we need to talk pediatricians with physicians following kids into adulthood about how to manage chronic pain. So again, why it's important? Chronic pain cannot be effectively managed if it is not accurately identified. So that's why we need to learn about the tools that we use to identify chronic pain. So that's why, the question that we had for this study and we wanted to answer is, what do pediatric pain tools really measure? And what this study proposed is to use a framework, the ICF, to compare the content exactly, to dissect each one of those measures and know exactly what they are asking about. And we're working on an ICF family tool, an educational tool. So I want to show you and share with you, hopefully it's gonna show, what are we working, and giving you more information about what is the ICF. So if I, so sorry, if I click, you should start the video. we tried it before. This one, and with a click you will start. It's just a 5-minute animation that this is just raw.
ICF stands for the International Classification of Functioning, Disability, and Health. It's a useful tool for healthcare providers and families to work together in helping a child reach his or her full potential. The ICF makes connections between a child's physical body functions and structures, and the activities he or she is able to participate in. The ICF also includes environmental and personal factors that may affect a child's ability to take part in an activity. The ICF uses a model called the Biopsychosocial Model to help healthcare providers to think about how the different aspects of your child's health condition interact. The model shows how a child's physical, social, and attitudinal environment, for example their relationships with others, plays an important role in determining what they are able to do. This has sometimes been ignored in the past when we have concentrated too much on a child's physical condition or physical limitations. We want to change that. We want to know more about your child's abilities. The model has 4 main parts. Body structures includes things like organs, limbs, arms, and legs, and their parts. We need to know as much as possible about your child's body so that we can see how they affect their body functions. Body functions are the ways that the different parts of the body work together. This also includes psychological functions, such as attachment and resilience. Activities are the tasks or actions that your child is able to perform. Participation includes engagement in social activities and having access to the tools and resources your child needs to take part in activities. At the bottom of the model, contextual factors include environmental factors, your child's physical surroundings, and personal factors, individual characteristics relevant to the functioning of the child. All of these things work together in determining whether your child is able to participate in activities. Let's look at an example of where environmental factors are important. Megan has cerebral palsy and uses a wheelchair. She is starting at a new school in the fall, but there's a problem. The school has no ramps or elevators, making it hard for Megan to get into the building. Using the model, we can see that the problem isn't with Megan's health condition, but is with the design of the school building, an environmental factor that we can change. So you can see that we need to think about all the different factors that contribute to a child's ability to participate, including their health condition, but also including environmental factors. It can also be helpful to think of facilitators and barriers. Megan faced an environmental barrier that had nothing to do with her condition. Lucas is 6 years old and also has cerebral palsy. As you can see, he isn't taking part in games with his friends. Let's see what happens when we use the ICF model to look at Lucas's situation. We can say that Lucas has a physical impairment that affects his brains, and that this affects his ability to control his movements, body functions. He isn't able to walk, for example. But Lucas has a wheelchair, environmental factor, to help him overcome this activity limitation. So there are other things that are preventing Lucas from taking part. Perhaps he is experiencing pain, or is not able to communicate effectively, activity, or he may be shy, personal factor, or not able to demonstrate that he wants to play with the others. Because we have used the ICF model to look at Lucas's situation, we can offer some interventions to help him join in. Doctors, therapists, and nurses often use specialist language that is hard to understand, but healthcare providers also need to be able to communicate with a child and his or her family. Clearly, we need a common language. That's where ICF and ICF course sets can be useful. These allow a healthcare team who work with a child and his or her family to learn what is important to the child and the family, and set goals. The child and his or her parents can share what the child likes to do, what he or she wants to be able to do, where activities take place. e.g. at school or at home, and what facilitators and barriers he or she is faced with during a typical day. The focus is on ability, what a child can do. We want to be able to identify and remove as many barriers as possible, and to provide facilitators where we can. Remember, we want to celebrate a child's abilities. We want to work together to help your child to reach his or her full potential. Thanks for watching. If you want to know more about the ICF, or if you have any questions, please refer to the ICF educational e-tool.
We're quite excited about that, and we are working with the Parent Association in British Columbia. This is the first version, but I thought, it would be great to share with you, and we're working to get your opinions. At the end of this educational animation, you'll have a couple of questions saying, what are the facilitators, what are the barriers, what do you want to achieve, and we want to learn all the positive ways about your child. So I think that will facilitate a conversation between the team and the parents. So going back to what we did with the pain measures, so we used the framework that now you're familiar with, and we look at all the measures that are available today to address chronic pain, and we try to translate the content into the ICF language. And what we learn is that most of the measures that have been used target just body functions, but not functional or activities that are impacted by pain every day. So for clinicians, knowing that they need to use, or the recommendation is that they need to use a combination of measures, it's not enough to ask, is he in pain or how much pain? So we want to know how pain impacts on daily living. So I'll give you some examples, and if you remember the color coding that we use, so body structures would be, an example is here in yellow that will say mark with an X, the exact place, so the location of pain. And in blue, body functions, that means intensity, how often, how much. But we want to see more measures tackling that functional domain, the red one, and asking questions like this. Can your child participate in recreational outdoor activities with other children the same age? Or please tell us about activities that you take part in and difficulties you may have. For example, and there's a long list on this measure, say, I do physical, recreational, or fun activities. So what this study adds, promote routine chronic pain assessment, so awareness about the importance of asking about pain, provide new information on pain-related measures. So we're going to share with everybody this ICF information, so hopefully that will guide families and physicians when we talk about pain. Encourage a holistic approach, the ones with the examples with Megan or Lucas, and help families and professionals set functional goals when addressing chronic pain. It's not just reduce the rating from 10 to 8 or the crying faces to a happy face. It just is beyond that, and using appropriate measures.